Good morning. Who's going to present the patient today?
I'll present her. So Kristen's a 15-year-old female. She's got a significant past medical history of asthma. When Alexa and I saw her last night, she told us that she, after school yesterday, had an increase in her baseline symptoms of cough and wheezing. So when she got home from school, she did extra treatment of albuterol with an inhaler and seemed to feel better after that. She, through the evening, did okay, and then around bedtime started to have some increasing shortness of breath, did another treatment, and wasn't getting better.
Okay.
Let her mom know, brought her into the emergency room last night. When they got her to the emergency room, she was having a pretty difficult time breathing. They started her with some IV steroids, gave her some oxygen by mask, and gave her some nebulizer treatments with albuterol. She seemed to do better after that, responded to the nebulizer treatments,
okay.
And so they brought her into the floor to be observed overnight. Overnight, she was able to finally settle around 2 in the morning, and this morning, when I saw her, she feels a lot better, feels like she's kind of back to her baseline, and she and Mom both were hoping that they might be able to go home today.
Okay. It sounds like a moderate to severe asthma exacerbation, though, with what you're describing to me. Alexa, did you assess the patient as well?
Yeah, I did. I saw her in the emergency room last night. She definitely had significant retractions, audible wheezing, and we measured her peak flow, and it was about 30% of what we would predict for her height. So I think the other thing that was significant was this was her second trip to the emergency room in 6 months, and I think they were a little scared by everything that happened yesterday.
Yeah, I can imagine that.
Yeah.
Well, why don't we go see her, and then we'll make a plan together?
Sounds great.
Okay. Good morning.
Hi.
This is Dr. Heyman. She's one of our pediatric attendings.
Hi,
this
Ms.
is
Schulin.
Kristen and her mom.
Hi.
Hi. So Dr. Craig and Dr. Emerson let me know what happened last night. It looks like you're feeling a lot better today.
Yeah.
Is it okay if I sit down so we can talk a little bit? Sure. Okay. So before we get you ready to go home, we just want to make sure that we have everything in place so that we can keep you healthy when you go home today, okay?
Okay.
So as a team, we had a couple more questions for you guys to get a little bit more history just about your diagnosis of asthma, symptoms that you may have with asthma, triggers that you notice.
Well, when I'm exercising, or if I have a cold, that sometimes triggers it, or when it's hot and humid out.
Okay. Do you do a lot of exercising?
Yeah, every day.
Okay. And do you feel that you have to use your albuterol inhaler a lot when you're exercising?
I don't like to use.
Tends to forget.
Yeah, I don't like to use that.
Tend to forget it? Okay.
Yeah.
Do you guys have a plan in place when you feel like your asthma is getting out of control for what to do? Or do you still have more questions?
Supposed to use the albuterol inhaler, but
Okay.
I think it's the timing is an issue.
Okay. Sometimes hard to remember all that stuff, isn't it? Yeah. Okay. Is it okay if I examine you, listen to your heart and lungs?
Yeah.
So if you just sit right there, I'm going to listen to your back. And I want you to take nice big breaths through your mouth. Good. Now I'm going to have you do a couple where you take a big breath in and blow out real hard like you're blowing out a candle.
Okay.
Good job. One more. Great. Do you mind if I have Dr. Emerson take a listen during this? Is that okay?
Yeah.
Okay. If you listen at the bases when she blows out hard like a candle, you can hear some end expiratory wheezes.
Yeah, you can definitely hear that, but it's better than it was yesterday.
Good, great, that's good to know. So as a team, we're going to spend a couple minutes outside talking about what we want you to go home with in terms of a plan to keep you healthy from an asthma perspective, and then we'll come back in and let you know.
Okay.
Does that sound okay?
Great, thanks.
Okay.